And welcome, everyone. I am Michael McGarry, the Senior Vice President of Venture Acceleration at Matter, and this is a webinar on a new report that the Peterson Health Technology Institute has released on virtual solutions for depression and anxiety. At Matter, our mission is to accelerate the pace of change of healthcare. We work to achieve our mission through a number of different programs. We run an incubator for healthcare startups, and since our founding in 2015, we've supported more than 1,000 companies from around the world that have raised more than $5 billion to fuel their growth. We run 6 to 8 startup accelerators per year. These are typically 3-month cohort-based programs that are developed in partnership with large health systems, life science companies, payers, associations, universities, and foundations that focus on particularly challenging areas of healthcare. We work with large enterprises to help them build their innovation capabilities with a suite of education, training, and services that help them make sense of emerging technologies and figure out how to harness them. We are also the digital health hub for BARDA, which is the arm of the Federal Department of Health and Human Services, tasked with nurturing innovations to make the country more resilient and prepared for future pandemics and other public health emergencies. And for all the startups and stakeholders we work with across the healthcare industry, it's critically important to understand where the industry is headed, what's working, what still needs to be improved. And today we are joined by Carolyn Pearson, who runs the Peterson Health Technology Institute. Carolyn launched the Institute to provide unbiased, independent evaluations of digital health technologies. They've released 4 reports to date, one on digital diabetes management solutions, one on virtual musculoskeletal solutions, one on digital hypertension management solutions, and most recently, a report on virtual solutions for depression and anxiety. That's the focus of today's discussion. As most of you know, or may have even experienced personally, the rates of anxiety and depression among U.S. adults and especially our younger folks continues to rise. Carolyn will share some of the data from that, but clearly the U.S. is experiencing a significant increase in the need for mental health care, driven by factors like greater awareness, reduced stigma, increased recognition of the impact of mental health on well-being. These are all fantastic things. In fact, I've got 2 kids, 21 and 22 years old, and the way that they approach mental health, their openness about it is really remarkable compared to how I grew up, for example. And so, but with this increased awareness and increased prevalence, there is an incredible need growing. And despite increasing demand, there are ongoing challenges within the mental health workforce that contribute to a perceived shortage. These challenges include things such as burnout and turnover, low reimbursement rates, limited access in underserved areas, an aging workforce, and a diversity gap. Virtual care solutions have been developed to address many of these challenges, but do they work? So let's find out. Carolyn will provide an overview of the report, and then we'll have a conversation about it. If you have any questions at any point, please use the Q&A functions as part of the webinar. I'll do my best to keep an eye on those. I believe we have a fairly large audience today, so I don't know that we'll get to all of them, but we'll do our best. And with that, Carolyn, it's a pleasure to meet you. And thanks so much for joining us again and sharing insights with the Matter community. I'll turn it over to you for your presentation.
Hey, Mike, thanks so much. I really appreciate being here. Always love the opportunity to share our findings with your audience and your community, but particularly to be able to answer the questions. I always come on and say, ask anything. We really like to engage with the content, and you guys do a great job of that. So thank you so much for having me. As folks, to just give you a sense of who we are, PHTI is an independent nonprofit entity that conducts evaluations of categories of digital health solutions, really on 2 key factors. Do they improve health outcomes, and do they lower costs? And as Mike teed up, our most recent report is focused on virtual solutions for anxiety and depression, with a particular emphasis on cases of mild to moderate anxiety and depression. This is not looking at severe mental illness, nor is it looking at things like PTSD-related symptoms. And just to give you a sense of how we do our work and how our process runs, obviously, first piece, we need to choose topics, and we generally are trying to find areas that have a significant or rapidly growing burden of disease. and are therefore generating not only significant impacts clinically for patients, but also driving healthcare spending in the United States. We're then trying to find areas where not only is the sort of clinical need significant, but that we are seeing dramatic and rapid innovation in the digital health space with new companies coming to market, really trying to bring innovative solutions that either improve access to care, drive better outcomes, improve equity, et cetera. And we're always looking for categories that are kind of at the right level of maturity. So we don't want to assess anything that is too nascent and still, finding its opportunity in the world. Nor do we want to choose anything that is too established, because we really want to be affecting decision making among healthcare purchasers. So whether that be health plans, employers, or in some cases health systems, we want to focus on those decisions on sort of which of these digital tools to adopt. We then begin our assessment process, and that is, like I said, focused on clinical effectiveness and economic impact, with the goal of trying to answer these three questions. Does the solution work? And of course, we need to take time to think about what work means for any given category, and we'll talk that through. For whom? Often we have high hopes that solutions will really deliver for a broad swath of patient populations, but we sometimes see that the clinical benefits are strongest for certain subgroups, and we want to help understand how to focus those benefits on the people who are going to see the most outcome. And then for solutions that do work, are they worth it? And at what price? And that'll be an important component of today's discussion. And from there, we make recommendations to those healthcare purchasers about whether to adopt those solutions, where they may need to do additional piloting or evidence generation, or which solutions simply aren't delivering. And we try to communicate that clearly with our sort of red, yellow, green categories, but the reports are rich and have detailed information behind them, and I encourage you to dig in if you hear things of interest. I will also note that we have a broad stakeholder process, and throughout our work, we engage with our Purchaser Advisory Council, which is composed of leading health plans, employers, and health systems that are making these decisions and help us understand how they're thinking and what areas they're going to be looking at next. Within the assessment process, we have clinical advisors that are specifically recruited and selected based on the topic at hand. We also do direct research with patients who not only have experience with the disease, but may have experience with some of the solutions. And then we work directly with the companies themselves. As part of the assessment, companies don't get to choose whether they're included, but we do encourage all of them to participate, to help us understand their offerings, and to share any evidence, commercial information, or pricing data with us. And we're pleased to say that many of them do in this report. 14 of the 15 companies that we looked at did actively participate with us. So let's dive into this particular assessment. As Mike teed up, we all realize in our daily life that anxiety and depression are incredibly common, growing more frequent, and sadly, they are often undertreated. More than 1 in 5 adults may experience symptoms of anxiety and depression at any given time. And we recognize that there are many different treatment modalities that may be effective. Historically, talk therapy or psychotherapy has been one of the gold standards, as have medication and pharmaceutical treatments for both conditions. But we also know that there are many other ways that people may address their mental health needs, particularly, again, for those folks with more mild and moderate symptoms. However, many people who would benefit from mental health care may not receive it. I think in many geographies in the country, providers have very long wait lists. Insurance coverage may be limited, or providers may be unwilling to accept insurance coverage. There is concerns about stigma, particularly in certain generations and certain demographic groups. And cost may be a significant concern. And so the virtual solutions really come to the market with an opportunity to dramatically expand access for people who may benefit from treatment and are not currently receiving it. Beyond the benefits to any individual patient and their family and friends to receiving treatment, the right-hand side of this slide shows you that there are also significant medical costs associated with untreated depression and anxiety. And we can see that as symptoms worsen, the cost burden of those individual patients to the system increases. And that increases both because of additional mental health needs, but also other medical costs. Those patients incur other healthcare spending, which does go down when we help treat their symptoms. So that brings the opportunity for the world of digital health to introduce new options for patients that go beyond sitting in an in-person room with a therapist and doing live talk therapy. Obviously, during COVID, we understand that much of live therapy has shifted to virtual and Zoom-based options. And we know that that transition works very well. I think that it was widely covered that mental health care is one of the most effective treatments that really can be scaled and in some cases can be more effective when it's delivered through virtual and remote modalities. But the question is, what else? So all of the solutions that are being reviewed in this report include a component which is a pure library of digital content. So these are self-guided activities, modules, trainings, and videos that an individual can use at any time on demand and that are based in CBT methods. And those libraries of content are available with additional sort of assessment and screening plans, and in some cases with additional coaching and engagement on the solutions that really encourage people to continue their care and continue to progress. In some cases, some of the solutions also go beyond the digital component and integrate networks of virtual prescribers, virtual therapists, and in some cases, medication prescribers. So this slide gives you a sense of the full landscape of solutions that we looked at. And they kind of increase in comprehensiveness and intensity as you move from left to right. So the first category, as we call, are self-guided solutions. And these are really focused on the content libraries, that digital content that people can access anytime. They are sold typically directly to employers, often as part of their EAP programs, or sometimes to health plans. And you'll notice that the companies with the asterisks are companies that have solutions that include therapists. They show up in that blended care, but they also will sell their, their content libraries and their digital content as a standalone offering in some cases. The second category, prescription digital therapeutics, of course, has gotten lots of attention and coverage in the media. And as these have relatively recently, been approved by FDA, and we're sort of working through the process for Medicare payment for these tools. From a user point of view, they are in fact quite similar to self-guided solutions. They are effectively libraries of digital content and activities. But the key difference is that PDTs, or prescription digital therapeutics, are sold directly to healthcare providers who then prescribe them to patients as part of a broader mental health care plan. So this could be a therapist who prescribes a PDT to a patient to encourage them to conduct some of the CBT modules between their talk therapy visits. Or theoretically, they could be prescribed by a PCP who may be giving a patient a medication script, but that person's not necessarily receiving therapy. And the PCP may be offering the digital therapeutic as an alternative or as an augmentation to their medication. And then on the third side, the third column are the blended care solutions. As I mentioned, these include all the components of the self-guided solutions in terms of the content libraries, assessments, and coaching. But they also add in those networks of therapy providers and in some case medication prescribers. And this is really where the bulk of the market is. So I think we will spend a lot of time talking about those blended care solutions because particularly when you speak to employers who are concerned about the mental health of their workforce, they may be concerned about their ability to meet mental health parity laws. it is the blended care solutions that they are typically looking to as an option for their employees. So diving into the clinical assessment, let me first say, how did we do this? And then I'll talk you through the complicated graphs on the screen. We do a systematic literature review, which looked at thousands of pieces of clinical evidence and screened all of those for relevance to this study. And we looked at over a dozen different outcomes within those studies. But we do always pick a primary clinical outcome to really guide our conclusions. And in the case of anxiety and depression, the kind of gold standard for measuring depression and anxiety symptoms are the PHQ-9 for depression and the GAD-7 for anxiety. And these are two validated scales that are widely used in the industry. And in this case, they are self-reported, so they can actually be collected both by clinicians, but also by the digital solutions as part of their regular and ongoing treatment. Now, what is interesting is also we always try to figure out sort of what is a minimum clinically important difference in terms of improvement. And we work hard on figuring that out. In the case of depression and anxiety, we are really focused on changes in patients' symptoms over time. And so we are looking for a reduction in PHQ-9 scores of at least 5 points. And we're looking for a reduction in GAD-7 scores of at least 4 points. And the field sort of says that that 5-point and 4-point threshold are what is necessary to really determine that the symptom improvement is going to be significant enough to have meaningful impacts on the patient. So while we always compare when possible, we compare to controls. The way that we're looking at it in this case is really to say, for any given patient, when they start on a treatment, whether that's usual care or digital health, are they meeting that minimum clinically important difference in terms of their symptom improvement? So this slide gives you a sense of what the results were for just the self-guided solutions. What you see here are sort of 4 sets of results. On the left, we've got depression. On the right, we have anxiety. And we're comparing it to 2 different patient populations. The first, the turquoise, is people who are not otherwise receiving psychotherapy. So these are people who this represents sort of the improvement in access. Someone who's not receiving talk therapy, not seeing a therapist regularly, but experiencing typically moderate depression or anxiety symptoms. They begin to engage with the self-guided content. And we see that they have a relatively significant improvement in their PHQ-9 and GAD-7 scores over baseline. So for the people not receiving psychotherapy, we saw a 7-point improvement over baseline in depression, which is 3.9 points more than controls. And for anxiety, we see an improvement of 4.6 points on the GAD-7 score on average, which is 2.1 points more than controls. Importantly, what we also see is, how often were people in the control arm reaching that threshold. And so you had many, many more patients that were receiving the digital solution, seeing that clinically meaningful improvement in their outcomes. By contrast, if we look at people receiving usual care, that's the green part of the chart, those folks are potentially seeing a PCP. They might have a medication script. A few of them some of them may be receiving psychotherapy. And like I said, others may be just getting other medical care for their condition. But there, the improvements of a self-guided solution are somewhat diminished. So in depression, we see only a 4.6-point improvement over baseline. And for anxiety, we see 3.5 points over baseline, neither of which quite reach that level of clinically important difference. So what does that tell us? Really, that suggests that self-guided solutions, these relatively affordable content libraries, can be an important and effective means to treat people who are not otherwise receiving care. They can improve access. However, for people that are receiving and actively engaging in their mental health care, they only offer modest improvements in their overall clinical outcomes. If we shift to the prescription digital therapeutics, we begin to see a bit of a different picture. So keep in mind that the prescription digital therapeutics, because they are prescribed by a clinician for mental health needs, they are really focused on people who are in usual care. So that group that was in green on the last slide is the group that are being targeted by these prescription digital therapeutics. And as I said, the intervention or the content of what's available to those patients is pretty similar, but they are inherently more integrated into a patient's treatment plan because they have a provider who is recommending it and who may be, may be helping them select which of the content that they want to engage with. And as it turns out, we see that that results in pretty significantly higher improvement in depression and anxiety results for those people who are receiving usual care when it is part of a PDT as compared to self-guided content. And so again, keep in mind on depression, we're looking for that 5-point cutoff. And you see that the PDTs have almost 6 points of improvement. And on anxiety, that cutoff is 4 points. And we're seeing that the PDTs are clearing that substantially. I will also note that because the prescription digital therapeutics do go through FDA review, the quality of the clinical evidence that supports these outcomes is quite strong and really superior to what we saw for any of the other categories. And so I think it is a compelling result that really shows that these solutions can augment usual care in ways that are clinically meaningful. So now we come to the blended care solutions. And one of the unfortunate things about this review is that despite the fact that blended care solutions is where the preponderance of the market is, we really saw a relative dearth of comparative evidence in that category. So many of the companies offering blended care solutions have produced clinical evidence, but most of them have not done it with a control arm in place. And so we're always looking at that change from baseline, but we also want to understand whether those interventions are clearing other controls. And so what we've done for you on this slide is try to line up the clinical improvements that we see in the evidence from the blended care solutions against the findings based on the comparative evidence for the self-guided solutions. So while it's not all apples to apples, you could think of this as the turquoise lines are really telling you what the impact of the content library is. And then the yellow lines are giving you the sort of incremental benefit of having a blended care solution that has both the digital content and a clinical provider. And what you can see is that, in fact, these solutions do outperform the self-guided solutions, in some cases quite substantially. And I think importantly, much more so on the anxiety side, where some of the improvements on anxiety were more modest for the self-guided solutions. You see really strong improvements here on the blended care solutions. And so while the evidence base is a bit weaker, these findings do suggest that combining access to live therapy providers with digital content can be an even more effective way to get people to see symptom improvement in ways that are very clinically meaningful. So what does it mean in terms of what it will cost? And while we can all acknowledge that treating mental health care is a national imperative, and certainly one that we hear from employers is very important to them, this is an expansion of care and it comes with added cost. And so we need to be realistic about how we're spending those resources and what the overall net impact might be on the healthcare system or on any given payer's bottom line. Now, the opportunity comes from the fact, as I showed you on that first slide with the bar charts, people with more severe anxiety and depression symptoms see higher annual healthcare spending. And so as we see pretty substantial symptom improvements, their healthcare spending comes down. And so in this sort of gray column, this gives you a sense of, on an annual basis, what the estimated reduction in healthcare spending would be based on the clinical outcomes that we saw for each of these three categories. And what you see is there is certainly, for people who use these solutions, there are not only real clinical benefits, but there are economic benefits as well. When we go over to the right-hand side and we look at solution prices, we see that the self-guided solutions are generally offered to the market at relatively low prices. So generally, they are charging $2 per member per month across all members or employees. And that's pretty comparable to often what some of the costs are for EAP programs. And some of these solutions can actually be swapped for EAP programs. But based on the estimated adoption rate, which would be which we see in the market for people who are eligible, for people who are eligible, people experiencing anxiety and depression symptoms, you can pretty easily clear this $2 per member per month cost by getting some portion of them treated with these self-guided solutions. On the prescription digital therapeutics side, I will highlight that reimbursement rates have not been finalized. On the Medicare side, the MACs are currently setting their pricing. There's been a lot of coverage about sort of where that pricing is going to land and whether it's too high or too low. Generally speaking, we are seeing most estimates about the device cost going to be reimbursed between sort of $200 and $400 per episode of care. And generally, that means that, again, you can clear those costs. And I'll show you this on the next slide. You can clear the costs of even up to $400 in the device supply. The blended care solutions really have a somewhat different pricing model. They are typically offering charging an access fee per member or per employee per month cost of about $6 per employee. So if you think about sort of any large employer that might be offering that, that's a pretty significant access fee just to make those solutions available to their members. And then for any individual who does actually participate in therapy, those therapy visits are billed typically additionally on a fee-for-service basis. And so you see kind of the pricing estimates here. Of course, each solution has its own pricing, and each employer or purchaser may negotiate different prices. So when you net all of that out, here is what you see in terms of the sort of net impact on healthcare spending for these three categories. And as I alluded to on the last slide, and I'm showing you here just commercial, which is where most of the activity is in this market. The report has additional information on Medicare as well. But in the commercial market, the self-guided solutions are estimated to reduce healthcare spending by about 30 cents PMPM. That's $3.6 million on a total per member per month basis. The prescription digital therapeutics at $200 in sort of a device fee save even more money because they have more significant clinical benefits. And of course, that's only apply, that those are only billed for people who actually use them as part of their clinical care. So the cost of those solutions tends to be more limited and is only applied to actual users. When we get to the blended care solutions, this is where you start to see that $6 per employee per month access fee really begin to have a significant impact. And at that pricing level, and with this pricing model, even though people who actually use the solution see lower spending, the across-the-board access fees mean that in total, spending goes up. And so that is something I suspect we'll talk a lot about. But that is what we see. But that suggests that there is a price point at which, and an engagement rate at which, if you had enough people using the solution and you could bring down those access fees, you'd get more people seeing the economic benefits from these solutions, and you could really have that win-win of improved clinical outcomes, lower healthcare costs, and better access. So we bring that all together in our reports, in our kind of stoplight graphics, and you see that here. And so, as I described, all of these solutions demonstrate clinical effectiveness, but with some nuance. So, the self-guided solutions are really delivering clinical benefits for people who are not otherwise accessing care, whereas the prescription digital therapeutics are delivering even superior benefits as part of usual care. So you've got sort of two different patient populations that are the strongest use cases for each of those respective tools. And then the blended care solutions really appear to deliver clinically meaningful benefits across the board, and strike us as quite effective. But if we look at the economic column, that impact of those high access fees does mean that they increase overall costs at current prices. And so we have sort of supportive broader adoption for both self-guided and prescription digital therapeutics, and sort of a yellow light for the blended care solutions, where we would say there is a real opportunity to do a lot of good for both patients and payers, if we can get those prices to a place that makes sense. And I'll conclude by just giving you a few thoughts on some areas for further growth. So one I mentioned is we'd love to see more evidence on it, comparative evidence, both from the blended care solutions and also really specifically focused on patients with mild symptoms. Most of these studies treated people with moderate symptoms where there's more opportunity for benefit. One of the concerns as we make mental health care more available is that you have the potential to have a lot of people with relatively mild or relatively short-term symptoms coming into care and potentially receiving relatively higher cost therapy. And so that really does beg the question of, can we find ways to appropriately triage patients? And we'll talk about that in a second. The second big piece is continuing to think about ways to enhance engagement. It is great news that these solutions are clinically effective, but they likely have not cracked the code on how to engage broad swaths of the population, and certainly not all demographic groups. When we look at the real world evidence, we see significant representation from younger white women, and somewhat less engagement from people of color, from men, though we see strong clinical outcomes when they do engage. And engagement is a huge issue in mental health. People who are anxious tend to be avoidant. People who are depressed tend to struggle with motivation. And so really thinking about not only how we treat people once they come to these solutions, but how we bring them into the solutions is going to be critical to realizing their full benefit. And then finally, we need to focus on appropriate ways to triage patients to ensure that we are meeting their needs with the lowest cost options available. Talk therapy is expensive, takes a lot of human capital, and we have good evidence that the self-guided solutions can be effective, particularly for people on the mild or moderate end of the spectrum. In fact, it may often be the case that someone who is experiencing more significant symptoms may need a few therapy sessions and could then be transitioned to some of those self-guided programs in ways that are clinically effective. And so we increasingly need to think about how to help figure out what patients need and navigate them, step them up and down between levels of care over time. So with that, I will stop sharing and invite Mike back, and I would love to dive in for questions.
Caroline, thank you so much. I had the privilege of actually reviewing the entire report. You did an insanely good job of distilling that into 12, 13 slides, but I would encourage everybody to review the full report. There is a wealth of information in there to provide insights, not only I think in regards to the specific companies that were part of the report, but just the industry in general. So thank you for that. But before we dig into specifics on the report itself, can you share the Institute is really remarkable, the work you do and the value you bring to the industry. Can you share just a bit more about what led to the creation of the Institute, the assessment protocol, how you came about, the methods you used, And then maybe even, how you're funded. How do you remain independent, an independent voice, in an industry that is, arguably trying to sell things, right? Everyone's trying to sell something. Yeah.
Everyone but me, maybe.
Yeah.
Um, but thank you for that question. So, we were launched 2 years ago out of the Peterson Center on Healthcare, which is a philanthropy. So we are a foundation, and we are on a mission to make healthcare more affordable and effective for all Americans. And that's a small
Just a little bit
a
of work ahead.
small
Yeah.
mission. And we haven't cracked the code on that yet. And so as we are sort of always looking for what are the areas where philanthropy could move the needle, right, could really make a difference, we've always been drawn to technology. We have so many healthcare challenges. We pay a lot for healthcare. We don't get enough for it in the U.S. And we've got a bunch of folks that we don't serve in an aging population. And so as you look to the future, we really do believe that there is an important role for technology to play, to really transform into the future of healthcare that we all deserve. And so that was the sort of starting impetus. And then we began to say, well, how would we do that? And what's
Hmm.
the opportunity? And we did probably about 200 expert interviews of folks saying, help us understand what the market needs and what your challenges are. And we just heard this resounding chorus from those digital health purchasers of people saying, gosh, COVID was important in terms of driving adoption of health technology in ways that were long overdue. But boy, we have been drowning in new point solutions and new startups and lots of pitch materials. And we think there's value here, but we can't separate the wheat from the chaff. And we're really sort of struggling
Hmm.
to make thoughtful decisions. And the more solutions we adopt, the more we're spending. And we want to make sure that we're making the right bets and really delivering value to our patients. And so, we said, well, gosh, that's something that we could potentially be helpful with. And that's how we were started.
That's fantastic. And your point around, well, COVID clearly changed the world in so many different ways, but you've also mentioned reimbursement and payment of these solutions throughout the report. I believe we've seen, as with other industries, Peloton spiked during the pandemic, and then all of a sudden people are like, no, I'd rather go into the gym. And, so the willingness for people to seek care virtually or in person does seem to ebb and flow, and pricing clearly a central part of that. With regards to, so this was, I believe, your fourth report that you put out.
That's right. Yep.
Okay, so who the target audience? Clearly, it seems like the healthcare customer, the entities that ultimately be buying these solutions, whether those be employers or health plans. Um, but it seems like there's value beyond just that. So, do you have a target audience when you're creating the data, or generating the data, writing the reports? I mean, it seems like entrepreneurs would benefit, policymakers would benefit. Do you really intend to reach a broad audience, or who's your target?
So, as we conceived of this kind of flywheel of what's the gizmo that we're building, we started with those purchasers, those people who are trying to make decisions day to day about digital health solutions, what they're going to buy, what they're going to onboard. Um, and so, that's our primary audience. That's really sort of the voice of customer that we're always trying to influence. But the goal is broader than that. Because what we really want to do is drive broader, faster adoption of high value health technology. And in order to do that, we need to be creating and innovating and producing high value health technology. And so we very much are trying to sort of speed the innovation cycle by saying, here's what's working, here's what's not working, and even in spaces where there's opportunity, here's how we continue to perform and get better.
Mhm.
And our hope is that innovators read these closely, and we've seen some positive signs in the market that they do, and that then figures into how they are creating new solutions and pricing them and selling them. And then similarly with investors, we want investors to be we want high value health tech to be a good investment. And so we want to
Yeah,
drive investment to the things that we think are working and delivering for all patients.
fantastic. So now, drill in more specifically into this report. the report looks at the industry category as a whole, right? I mean, it was a 15 companies. I think 16 asked to participate, 15 did. But you don't really dive deep into any one of the particular company's solutions or data. You really present, do virtual solutions work? And the conclusions were, 2 out of 3, yes. Uh, is there wide variability though between the companies and solutions? Did you find that they had fairly similar outcomes, or how do you warrant, kind of lumping them all into, the industry as a whole is beneficial?
Right. Well, we spent a lot of time debating sort of the benefit of categorical ratings versus what can we say reliably about individual companies.
I would
And
imagine,
we
yeah.
keep getting pulled to do more and more company specific work. And so you'll probably see that every report has more length and detail about sort of specific company results. But let me kind of explain why we continue to focus on categories as a starting point. First and foremost, I think the sheer process of identifying the categories, I hope contributes a lot to the market. It's a very hard part of our process. When they land, people find them sort of self-evident, but generating them up front is not at all self-evident. And really what we're trying to do is take a sort of very heterogeneous group of companies and figure out sort of like what is the mechanism of action, right? What is the
Mhm.
differentiation between these approaches that matters? Everybody has something that they're proud of, right? Some engagement tool that they're proud of, like something that they've worked hard on, and there's lots of differentiation. And we're trying to say, from that clinical point of view or from how it's being sold and priced, where are there some lines just to help those buyers, those purchasers, think about, A, is this even worth me spending money on? And
Sure.
B, kind of like what group of solutions do I want to look at? From there, every purchaser is going to need to make their own decision. And that's not my job. They've got different membership bases, different needs, different priorities, different willingness to pay, ability to pay.
Sure.
And so, I do want to sort of leave that end purchasing decision in their hands. And yet I recognize that, particularly in this report, the blended care solution category was big. And so I've had a lot of employers say like, okay, great, I'm sold, but like now I still have to pick among them. And I think, as you suggest, a detailed review does suggest that there are not only differences in approach. Companies like Brightside tend to really be focused a little bit more on the more severe cases and have a more intensive approach. Some of the solutions are a little bit more of a choose your own adventure, kind of pure access. Others have
Mhm.
very sort of prescribed treatment programs that they like to walk people through. And we do at least try to describe that and describe some of the variation in the results that we see as, coming out of that.
Yeah, you mentioned the word access, and I think in the work we do, uh, both within Matter and the companies we support, but also just the health systems we work with across the industry. Access, I think, historically has been misunderstood. It's usually very narrow. It's like, oh, I can't access care because something's not close to me, perhaps. But it's really an incredibly broad spectrum of it might be proximity to care, it might be affordability of care, it might be stigma around receiving care. Uh, any number of uh, variables contribute to access, and I think that really warrants supports your answer of looking at a category as I would imagine each of the individual companies and solutions probably has a different spin on how they solve access. Maybe some are more sensitive to age, for example. They might target a senior audience. Some might target more rural solutions where there really isn't physical access to care. So it makes all the sense in the world. Um, one of the other things we see, and this is just technology, and I think it probably more broadly than just clearly virtual solutions in mental health, but the pace of change of technology relative to the pace of change of healthcare. I always used to joke that healthcare moves at the speed of life, and technology moves at the speed of innovation. Uh, you know, Sometimes the companies I can imagine that you might include in a report, by the time you adopt a solution, they might be out of date or a year later. Um, you do a couple of really remarkable things. I think when you're choosing your companies, you look. well, one, clinical outcomes, which I think a lot of folks, would immediately kind of default to, hey, does it work clinically? Then you go to the next level of financial outcomes, which I think a lot of early stage companies in particular, they tend to forget, and not forget, or they don't put enough focus on that, right? It has to drive the clinical and the financial results. But you also look at the financial stability of the company, for example. Is a company we're included in this report, will they be around, you know, next year? Uh, how do you decide, or, what's the process of deciding who's in a report, who's out of a report? And of course, they have the choice to opt in or out of participating, but you come up with an initial list. And what's the process to do
Yeah,
that?
well, let me actually first clarify. So the companies don't get a choice as to whether they're included. Uh, they get a friendly email from us saying,
Okay.
you're going to be you've been selected, you've met the inclusion criteria. We'll talk about that in a second. And we would love your active participation. But whether companies can't beg, borrow, or steal to be either in or out, though everyone still tries. Uh, um, and no, really, what we try to set clear inclusion criteria, which are detailed in the report, that are both kind of about the approach, so you're comparing like with like,
Mhm.
but that are also about sort of company maturity and size, at least so that we're not including tiny companies up against really well-financed mature ones. And so we set a bunch of parameters, and then we try to do a market scan and basically attempt to capture every relevant company that meets those inclusion criteria. So that's the idea. Now, as you know, the market is complicated. There are a bunch of line calls and judgments that we end up needing to make. But the goal is really to give you sort of the full picture of companies that meet those criteria, and then
Mhm.
really do sort of compare them across the categories.
Interesting. So I'm looking now to some of the questions coming in from the audience. A few questions around, it would be impossible to imagine any technology discussion today without AI coming into a question, right?
Yeah.
You do mention it briefly in a little call out box in the report about AI chatbots. Uh, how much do you see, or if you did go into this within the report? If not, I guess I'm probably seeking more your personal opinion. But
Yeah.
how much is AI disrupting this industry, and or might this be a focus of a future report that you're doing? Yes.
Well, I think the chatbots. I was sort of sad that we wanted to get the chatbots into the report, and there really just aren't. At the point that we started, there really weren't companies that were commercialized and using them in a significant enough way that it warranted inclusion. And the evidence has been thin. But during the course of the report, we saw some initial evidence come out, and I would say the initial evidence around the chatbots is quite promising. One of my takeaways from this whole review is that, at least for people with mild and moderate symptoms, there are lots of things that work. Right? So chatbots work, the self-guided solutions work, but even within talk therapy, you find that asynchronous video therapy works, text-based therapy
Mhm.
works, and then you can look more broadly to things that aren't even clinical in nature. And so it's really about, how do you get somebody to decide to engage in their mental health care, make it easy for them to do so, and then keep that stickiness to sort of keep them working on it.
Mhm.
And that seems to be sort of where the opportunity is. So that's something that chatbots are great for. Like, AI is great for, right? It is great for a
Yeah.
custom, engaging, I mean, we all have experienced it, so sticky, and I'm quite optimistic actually about its potential.
It's I have to, I have to admit, like, personally, it frightens me just a little bit how good these are getting,
Yeah.
right? We're seeing AI creep into pre-screening calls for primary care offices, and they're pulling data from your health record. They're pulling data from other areas, and they're engaging in a very human way. So I agree with you. I see a ton of promise, and obviously, hopefully, a lot of oversight and control on how they're deployed. But really, really remarkable what they can do.
I think that's one of the big concerns. So, Wobot was a company that had developed really a CBT based chatbot, and they shuttered that product during the course of the report. And my sense is that actually any mental health chatbot is getting so much competition from the regular large language models, whether it be ChatGPT or anything else,
Mhm.
that it is hard to compete. But those models aren't trained. They don't have that expertise, and I do think thinking about how to make sure that a general purpose model is delivering safe and effective mental health support is important.
Yeah, yeah. One of the concerns around AI as well, would seem to be, privacy, data security. Uh, I I don't know that you went into too much detail in the report on that topic, but in conversations with some of the customers or the patients, excuse me, that you worked with, do you find there's more willingness to meet? I've experienced, and this shocked me, 10 years ago when people are like, oh, I'd rather meet with a virtual therapist. It really eliminates a lot of the stigma. Sometimes just driving to a therapist's office and parking in the parking lot, who's going to see me stepping out of my car? There might even be greater engagement, uh, with virtual solutions and AI chatbots. But did, did privacy, data security, that factor into any of the sort of the uptake or outcomes? Did you?
Yeah,
Oh,
I think it's an astute observation because it didn't turn out quite how I expected. So I really thought that the stigma and the privacy concerns was going to be significant, particularly because many of these solutions are being sold to employers, right? It's your
mhm.
employer has the solution. People don't quite know what information they have access to, and so I thought we might hear a lot more concern from patients and frankly from employers about participation, and it's the opposite. And I think it's exactly what you said. There's a component of anonymity, sort of remoteness that, in fact, might be improving willingness to engage in this case.
Yeah, and I think just across the board, willingness to accept technology, um, especially when we look at. So, in one of the final sections of the report, you kind of dive into health equity outcomes, right? Looking at how do outcomes differ between, could be gender, could be age. Historically, I think people make the assumption, digital solutions are going to resonate with the teens and the 20 somethings, and if you're over 60, they simply won't work. You're not engaged in technology. I personally, through the work I've done, have not found that to be the case. In fact, sometimes the opposite. We're seeing, I guess, related to depression and anxiety, loneliness, is a growing concern. And we're seeing solutions for the senior population, virtual solutions, AI solutions around that. um, can you share just a little bit more around sort of health equity and where you saw differences in the uptake and outcomes of these solutions?
Well, I think across the board, across all four reports, there continues to be this narrative that older adults aren't going to engage in digital, and we just have seen very little evidence of that. And in some of the cases, we've seen quite the opposite. I mean, you mentioned loneliness. I would say our physical therapy report was one where I assumed that older adults would do much better with in-person therapy, but they said no. I can do the therapy, but I can't transport myself there, right? I don't drive anymore. And so home is really good. Same thing here. The clinical findings across every demographic group where we had data were really quite similar. And so, these interventions worked for everybody. But we did see differential impact and take up. And, some of that I think is less about the digital solution and more about, societal willingness to accept and ask for help for mental health care. And, I flagged the one that worries me is gender, right? I think particularly getting men to engage in their mental health care is something that we as a country still do a poor job of.
Yeah, I think we got a long way to go there, but seeing progress for sure.
Yes. Yes. Well,
um,
perhaps these solutions will be the way that we get the door open.
I hope so. I hope so. Um, I think virtual solutions around therapy seem to be readily understood. Everyone, I think, is familiar with Talkspace or chats and text. We had a question. I think it's worth surfacing. Um, Digital therapeutics are, I think, a little less known. Definitely, sort of amongst the average consumer. Can you share some examples when we say digital therapeutics? What is that? Is that a separate device? Is that still a mobile experience? Uh, what is a digital therapeutic?
Yeah, so these are generally kind of apps. They're available on your device, and they have these CBT-based content libraries. So folks may not be super familiar with cognitive behavioral therapy. It is one type of talk therapy, not the only one. But even in person, it actually has like a lot of sort of rigid exercises. You do homework, you do worksheets. There's sort of prompts, and it is about creating structures for engaging in your experiences and being able to manage and process them. And it lends itself very nicely to digital conversion. So some of it is watch a video that reframes the way you're thinking about something. Some of it is do an exercise. You can imagine a worksheet translates to a much more engaging experience as a interactive on your app.
Mhm.
And then they also often have, guided meditations and other things that people may be more familiar with from their sort of like non-medical, the calm apps of the world. So there's those components, and then there's really the therapy components. But yeah, videos, interactive activities, sometimes games, sometimes podcasts, all sort of available on the app.
And probably the biggest differentiator, they've gone through the rigor of actually completing clinical studies, regulatory
Right.
clearance. So they're sort of
Very
next
different than calm.
level.
Yes, actually,
Yeah,
yeah, 100%. Much
yeah,
more different. I only from something people may have experienced since do I draw the analogy.
yep, fantastic. We mentioned the target audience for this or for your reports. The Matter community is just full of aspirational founders, early stage startups. The information in this report could absolutely be a roadmap, uh, for existing or new entrants into the space. To the entrepreneurs who are, on the line here watching, what advice would you give? Where do you see the opportunities?
Well, I think I always say I really want you to invest in clinical evidence. And for many, many years, that wasn't the right business decision. And my job is to make investing in clinical evidence a good business decision for every founder. And we are starting to see that. I think companies that know that they are delivering great
Yeah,
results feel really confident, and they ask to be assessed. So, that is one. And then, really understand you're doing so many things at once, but understand that mechanism of action. What is the one thing that you can never let slide, or it will affect your clinical results? Everything
mm,
else is engagement, it's UX, it's extra, and it's great. But make sure that you really know what your clinical model is and that you retain it as you scale.
I think that's incredibly valuable advice. And with that, I think we got about 30 seconds to a minute left. We're at the top of the hour. So, Carolyn, I want to thank you sincerely for coming on the platform again and sharing your insights. Not only this report, but your prior reports are available on your website. Just a wealth of information. I really enjoyed the discussion and hope you come back again when the next report is out.
Thank you so much for having me. I really appreciate it, Mike.
All right. Have a great day. And for everyone who joined us today, keep an eye out for a survey in your email, as well as there'll be a recording of this session. Please join us this Thursday for another webinar on wearable technologies with VSP Vision. And also, Matter has a number of upcoming programs. Encourage you to check them out, matter.health/events. And with that, we'll close out. Carolyn, again, a most heartfelt thank you. And everyone, thank you for joining us today.